At Circle of Care, our mission is to support individuals' independence and sustain and enhance quality of life in the community. Our values include person-centered care and safety. This video will help you provide safer care in the home, whether you are a personal support worker or a family caregiver. Hi, welcome to the Circle of Care Moving and Handling training video. I'm Natalie, and I am a moving and handling educator with Prism Medical. So what is moving and handling? Moving and handling refers to the transferring and repositioning of people. Transferring means moving someone between two separate surfaces, and repositioning means moving them along the same surface. Moving and handling includes all of the things that you do to move a person. Everything from verbally telling a person what to do, to using equipment to move a person who cannot move themselves. In this video, we will introduce you to the basics of moving and handling, as well as show you a variety of techniques that can be used. The goal of this video is for you to understand safe principles of moving and handling. The most basic thing to keep in mind for all moving and handling tasks is your own body mechanics. Proper body mechanics are a way of holding and moving your body that can help to protect your body when doing certain tasks. Having proper body mechanics when moving and handling can reduce the risk to you. Body mechanics are important to minimize your risk of injury. Some basic principles of body mechanics are: keep your feet apart with one foot in front of the other to increase stability. Keep your knees bent. Move in the same direction that you are moving the person, and keep the person close to your center of gravity. Avoid twisting or stooping. And try to maintain the natural patterns of the spine. It is important to think carefully about all moving and handling tasks each and every time you attempt one. This will help to minimize the risk to both you and the person you are helping, and will help to make your practice safer. One way to help you think more carefully about moving and handling is by doing an assessment. The LIGHT assessment is a tool that will help you to consider the factors related to yourself, the task, and the environment before each and every moving and handling task. LIGHT stands for the load, which means the person, the individual, which is you performing the moving and handling activity, the task, which is the actual moving and handling activity that you are going to do, and the environment, which are all the factors in the space where you are performing the task. By thinking through all these elements each time you perform a moving and handling task, it will be easier for you to see safety hazards, risks, or alternatives before you attempt the activity. In this video, we will show you many techniques for moving and handling. In order to know which technique to use with which person, you should consult a healthcare professional such as an occupational therapist. As you watch the rest of this video, try to pause it and practice the techniques. By using these techniques correctly each time you do a moving and handling task, you can help to reduce the risk to both yourself and your loved one. These are the key steps to remember on safe moving and handling that are beneficial for both yourself and the person you are assisting. Keep your feet apart with one foot in front of the other. Keep your knees bent. Move in the same direction that you are moving the person. Keep the person close to your center of gravity. Avoid twisting or stooping. Maintain the natural patterns of the spine. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Sitting to standing for people who can weight bear. This transfer can be used with people who can weight bear, which means that they are able to carry their own weight with at least one of their legs. Before attempting this transfer, make sure that the person is able to bear weight. When doing this activity, make sure that you have the person help out with the task as much as possible. Only help when you need to. Start by asking the person to shift their bottom to the edge of their chair. If the person needs help shifting to the front of the chair, you can help them by first kneeling on one side of them. Place your hand on the hip that is closest to you and your other hand on the knee that is farthest from you. Tell the person what you are going to do and ask them to help as much as possible. Use your hands to shift their hip forward in the chair. Stand up, move to the other side of your client, kneel or squat, and then repeat the same action on the other side. Continue this action until the person is at the edge of the chair. Remember to squat or kneel instead of stooping. This will help to protect your back. Make sure that the person's feet are flat on the floor and hip width apart. Ask the person to put their hands on the arms of the chair or directly onto the seat of the chair if there are no arms. Stand at the side of the person. If they have a weaker side, stand close to this side. Make sure you face the direction that you are going to move. Bend your knees and hips. Place your outer foot slightly forward. Offer the hand that is furthest from the person for them to hold. Do not interlock your fingers or thumbs. Place your hand that is closest to the person on their back. If they need more support, place your hand on their hip that is furthest away from you. Remember to bend your knees instead of leaning or stooping forward. This will help you to protect your back. Ask the person to lean forward slightly and tell them that you are going to help them to stand up. Remind them to lean their nose over their toes and look forward when standing up. Give clear instructions of ready, steady, stand.
Okay, ready, steady, stand.
When you say stand, support the person by moving together in a forward, upward direction. Take a step forward with your back foot and slide your hand up the person's back. Or, if your hand is on their hip, use it to guide the person to standing. Do not grip or lift the person. Remember to move in the same direction as the person. Make sure the person feels steady and ask them if they feel dizzy. If they feel unsteady or dizzy, ask them to sit back down. These are the key steps to remember on how to guide a person from a sitting to a standing position for people who can weight bear. Have the person shift to the edge of the chair. Make sure the person's feet are flat on the floor. Have the person put their hand on the chair. Stand at the side. Face the direction of movement. Bend your knees and hips. Offer your hand. Don't lock thumbs. Place your hand on their back or hip. Say, ready, steady, stand. Move together. Step forward. Do not grip or lift. If they feel unsteady, sit down. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Using a transfer board for sitting to sitting transfers. Start by making sure that the surface the person will be moving to is positioned between 45 to 90 degrees from their current location. Make sure that the two surfaces are about the same height. If transferring to or from a wheelchair, make sure that the brakes are on and the armrest is off or out of the way. Help the person shift their bottom to the edge of the surface that they will be transferring from. Ask the person to lean away from the transfer surface.
So first thing, can I get you to lean away from me a bit? And I'm just gonna insert the transfer board underneath you.
Place 1/3 of the transfer board underneath the person's bottom. Make sure to press down on the board as you slide it to avoid pinching the person's skin. When placing the transfer board, remember to kneel or squat. Don't bend or stoop. Try to make sure that 1/3 of the transfer board is under the person, 1/3 of the board rests on the other surface, and the middle third of the board is in between the two surfaces. Ask the person to lean toward the far end of the transfer board and place their hand on the end, making sure that they do not curl their fingers under the board.
And you can sit back up, and can you put your hand over here? And all your weight's gonna go in here, and you're gonna shift yourself forward, and I'm gonna help you at your hips, okay?
When the person is ready to make the transfer, ask them to shuffle their bottom across the board, using their arms and legs to push if they can. If they need help, you can help the person move along the board by kneeling behind or in front of them and placing your hands on their hips. You can help to guide them across the board. Remember not to stoop or twist your body when you are helping them. Once the person has completed the transfer, ask them to lean away from the transfer board.
And if you can lean over a bit, I'll just take this out.
Once you are sure the person is seated safely, you can remove the transfer board. These are the key steps to remember on how to use a transfer board for sitting-to-sitting transfers. Make sure that the surfaces are the same height. Have the person lean away. Place the transfer board under the person. Kneel or squat. Have the person place their hand on the end of the transfer board. Make sure the person does not curl their fingers under the board. Ask the person to shuffle their bottom across the board. Help by placing your hands on their hips. Remove the transfer board. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Using a slide sheet to reposition in bed. Slide sheets can be used to reposition a person in bed. You might need to do this in order to bring the person up towards the head of the bed or closer to you in order to complete other care tasks, like a bed bath. There are many different types of slide sheets. Some have two separate slide sheets working with each other, and others are a single tube of fabric that slides over itself. Some slide sheets have handles, and some don't. In this video, we will be using two separate slide sheets placed together, but the same techniques can work with other types of slide sheets. Make sure you get to know the slide sheets that you will be using. Start with the person lying in bed. Ask the person to bend one knee and plant their foot firmly on the bed. You can help them do this if they need help. Ask the person to reach across their body to the side that they will roll towards. They can hold on to a bed rail if there is one. Help the person roll by placing one hand on their shoulder and the other hand on their hip. Roll the person towards you and shift your weight from your front foot to your back foot, instead of pulling with your elbows. Remember to shift your weight and avoid twisting or pulling in order to keep your back safe. Help the person by saying, ready, steady, roll. Make sure that the person feels safe lying on their side. Walk around to the other side of the bed and get the slide sheets. If you are using two separate sheets, make sure that you have both of them and that the correct sides are facing each other. Tuck both of the slide sheets under the person, pushing down on the bed to get them as far as possible and to avoid hurting the person's skin. Ask the person to roll onto their back. If they need help, you can put your hands on their shoulder and back and shift your weight from your front to your back foot. Have the person roll to the other side slightly. Walk back to the other side of the bed. Unravel the slide sheets on the other side. Make sure that the slide sheets are centered under the person and that they are positioned under the person's shoulders and bottom. Once you are sure that the slide sheets are positioned well, you can move the person. If you want to move the person closer to the edge of the bed, stand on the side of the bed that you are going to move the person to. Grasp the top slide sheet in both hands, close to the person's heaviest areas, usually the shoulders and the hips. Stand with your feet one in front of the other and bend your knees. Don't stoop, pull, or twist in order to protect your back. Tell the person what is going to happen. When you are ready, shift your weight from your front foot to your back foot. If you want to move the person up in bed, you need to have access to the head of the bed. If possible, have the person bend their knees and plant their feet firmly on the bed. Always place a pillow at the top of the bed to protect the person's head. Walk to the head of the bed and grab hold of the top slide sheet in both hands. Make sure you tell the person what you are going to do and have them help as much as they can by pushing themselves with their legs. Make sure you have one leg in front and one leg behind and shift your weight from your front leg to your back leg. Use the motion of your body instead of pulling with your elbows. To remove the slide sheets, ask the person to bend their knees and put their feet flat on the bed. Reach your hand under the person's knees and grab the corner of the top slide sheet over the top of your hand. Pull the slide sheet so that it slides underneath itself. Keep pulling using one hand, then the other, until the slide sheet comes free. Walk up the side of the bed as you remove the sheets, instead of pulling with your arms. Remember to avoid twisting or yanking the sheet. This will help you to protect your back. Now, repeat the same thing with the other slide sheet. These are the key steps to remember on how to use a slide sheet to reposition a person in bed. Help the person roll towards you. Tuck the slide sheets under the person. Push down to help tuck them under. Help the person roll to the other side. Unravel the slide sheets. Grasp the top slide sheet. Shift your weight from your front foot to your back foot. To remove the slide sheets, reach your hand under their knees. Grasp the top sheet. Pull the sheet under itself. Repeat with the other slide sheet. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Sling and lift systems are useful for people who cannot bear weight at all through their legs. There are two main types of lifts, floor lifts and overhead lifts. Floor lifts have wheels and can be rolled on the floor from one place to another. Overhead lifts move along a track. They can be attached to a ceiling or on a freestanding frame. All types of lifts will have a bar with hooks, which is where the sling and the person will be attached. All lift systems work with slings. Slings come in a wide range of materials, shapes, and sizes. Most slings will be made out of mesh or polyester fabric. The most common shapes of slings are universal and hammock. Slings come in many sizes to suit the sizes of different people. During this training, you will learn what type of system and sling you will be using. If, while using a system, you think there might be a problem with any of the equipment or transfers, you should consult a healthcare professional such as an occupational therapist. One of the most important parts of using these systems is being able to apply the sling in a safe and comfortable manner. Before you begin the transfer, make sure you are comfortable with the equipment and that all of the equipment is in good working order. In this video, we will show you how to put on and take off a sling while the person is lying down and while the person is sitting in a chair or wheelchair. Full lift, applying a sling in lying. Start with the person lying in bed. Ask the person to bend one knee and plant their foot firmly on the bed. You can help them do this if needed. Ask them to reach across their body to the side that they will roll towards. They can hold on to a bed rail if there is one. Help the person roll by placing one hand on their shoulder and the other hand on their hip. Roll the person towards you and shift your weight from your front foot to your back foot instead of pulling with your elbows. Help the person by saying, ready, steady, roll. Make sure that the person feels safe lying on their side. Walk around to the other side of the bed and get the sling. Now you will position the sling under the person. Start by laying the sling out on the bed and folding it in half, making sure that the tag or back of the sling is on the outside. Position the sling along the person's back. Leave a space so that when the person rolls onto their back, their spine will be in the middle of the sling. Make sure that the top of the U shape is right above the person's bottom and that the top of the sling is at the person's shoulders. Tuck the top fold part of the sling under the person's side, pushing down into the bed to help get the fabric under the person and avoid hurting the person's skin. Help the person to roll onto their back and then roll again towards you, as you did before. Walk to the other side of the bed and pull out the sling on the other side. Make sure that the sling is centered under the person. Help the person to roll back so they are lying on their back. Now, tuck the leg straps under the person and crisscross the straps, threading one of the straps through the hole in the other. Once the sling is positioned well under the person, you can attach it to the lift. Remember to match the colors of the loops on each side. Different loop combinations will give the person a different position in the sling. If you want the person to be in a seated position, remember, short at the shoulder and long at the legs. If you don't know which loops to use, you should consult a healthcare professional such as an occupational therapist. Now you are ready to lift the person and move them. Always watch carefully as the person is being lifted and check that all the loops are secure.
Okay, Diane, I'm gonna lift you now. If you feel uncomfortable at any time, just let me know. Okay.
To remove the sling, first make sure that the person is safely on the bed, and then remove the loops of the sling from the lift. Roll the person like before and move to the other side of the bed. Tuck the sling under itself. Press the sling into the bed and under the person as much as you can. Help to roll the person onto their back and then towards you. Walk to the other side of the bed. Remove the sling from under the person and then help the person to roll onto their back. These are the key steps to remember on applying a sling in lying with one person. Help the person roll towards you. Say, ready, steady, roll. Fold the sling in half. Make sure the tag is on the outside. Position the sling along the person's back. Leave a space. Tuck the top half of the sling under the person. Pull out the sling on the other side. Tuck the leg straps under the person. Cross the loops. Match the loop colors on each side. For a seated position, remember, short at the shoulder, long at the legs. Watch carefully when lifting. To remove the sling, roll the person to one side. Tuck the sling under itself. Roll the person to the other side. Remove the sling. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Full lift, applying a sling in lying when there are two people to help. Start by rolling the person to their side, having them help as much as possible. Remember to put one foot in front of the other and shift your weight from your front foot to your back foot. Avoid pulling or leaning.
That's great. Okay, Diane, you're gonna feel this sling against your back now. I'm just lining it up with your spine. And I'm just gonna...
Now you will position the sling under the person. Start by laying the sling out on the bed and folding it in half, making sure that the tag or back of the sling is on the outside. Leave a space so that when the person rolls onto their back, their spine will be in the middle of the sling. Make sure that the top of the U shape is right above the person's bottom and that the top of the sling is at the person's shoulders. Tuck the top fold part of the sling under the person's side, pushing down into the bed to help to get the fabric under the person and avoid hurting the person's skin. Have the person roll to the other side slightly and unroll the sling so that it is flat under the person. Now tuck the leg straps under the person and crisscross the straps, threading one of the straps through the hole in the other. Once the sling is positioned well under the person, you can attach it to the lift. Remember to match the colors of the loops on each side. Different loop configurations will position the person differently in the sling. If you want the person to be in a seated position, remember, short at the shoulder and long at the legs. If you don't know which loops to use, you should consult a healthcare professional such as an occupational therapist. Now you are ready to lift the person and move them. Always watch carefully as the person is being lifted and check that all the loops are secure. These are the key steps to remember on applying a sling and lying with 2 people. Help the person roll towards you. Fold the sling in half. Make sure the tag is on the outside. Position the sling along the person's back. Leave a space. Tuck the top half under the person. Pull out the sling on the other side. Tuck the leg straps under the person. Cross the loops. Match the loop colors on each side. For a seated position, remember, short at the shoulders, long at the legs. Watch carefully when lifting. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Full lift, applying a sling in sitting. Bunch up the sling in your hands, making sure that the back of the sling is facing away from you. Ask the person to lean forward. If they cannot, you can use the sling around their shoulders to gently bring them forward. Tuck the sling down behind the person's back, making sure that the tag is on the outside. The bottom edge of the sling should fall just at the top of the person's bottom. Kneel or squat at one side of the person. Remember not to stoop. Bring one leg strap down along the person's thigh and under their leg, pushing into the wheelchair cushion to help get the sling underneath. Stand up and reposition yourself on the other side of the person. Repeat the action on the other side. Crisscross the straps in between the person's legs by passing one loop through the strap of the other loop. Bring the top of the sling up along the person's back, making sure it is at their shoulders. Once you are sure the sling is positioned right, you can attach the loops to the lift. If you are using a rolling floor lift, there are a few things to remember. Be careful of your back as you roll the lift on the floor. Don't twist your back or strain. Go as slow as you need to protect yourself and your back. Also remember when using a floor lift to be careful of the person's head as you move the lift towards them, and do not put the brakes on the lift when you are using it.
Okay, Diane, we're ready to lift. I'm going to start to lift and you just let me know if you're feeling uncomfortable, okay?
Remember to always keep your eye on the lift while it is lifting the person and make sure that the loops are positioned correctly. To remove a sling in sitting, first make sure that the person is safely in the chair and positioned well. Remove the loops from the lift and carefully move the lift out of the way. Always move the lift slowly and don't rush in order to help keep your back safe. Ask the person to lift one leg. If they cannot help, you can lift their leg and place it on your thigh. Pass the leg strap under itself and pull it out on the other side. Repeat this step on the other side. Ask the person to lean forward. If they need help, you can assist them by standing next to the chair, putting your hands behind their shoulders and shifting your weight from your front leg to your back leg. Remember, don't stoop or pull with your elbows. Remove the sling from behind the person and help them to lean back. These These are the key steps to remember on applying a sling in sitting with one person. Bunch up the sling in your hands. Tuck the sling down behind the person's back. Kneel or squat at the person's side. Bring the leg strap down along the thigh and under the leg. Repeat on the other side. Crisscross the straps. Bring the top of the sling up along the person's back. Watch carefully. To remove the sling, remove the loops. Move the lift away carefully. Remove one leg strap. Remove the other leg strap. Remove the sling. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. Transfers into the car for people who can weight bear. Some people might need help getting into and out of a car. This should only be tried with people who can bear some weight through their legs. In some cases, people who cannot bear weight through their legs might be able to use a transfer board to get into and out of a car. Before attempting to use a transfer board for a car transfer, make sure you receive specific instructions on how to do this. Some of the equipment that can be used for car transfers are a handy bar and a transfer disc. The handy bar hooks into the frame of the car, which gives the person an extra place to hold onto while making the transfer. The transfer disc can be placed on the seat and will help the person when turning and moving their feet into the car. To help a person get into a car, first place their wheelchair next to or at a slight angle to the car door. Stand facing the person and ask them to move as close as possible to the edge of the wheelchair. Help them if they need extra support. Assist the person to stand up, providing support at their shoulders and hips. Do not lift the person or grab them. Tell the person to hold the door frame or the back of the car seat's headrest for support. Tell the person not to hold the car door because it can move and throw them off balance. Once the person is standing, support them to pivot and take small steps back to the car until the person can feel the seat at the back of their knees. Assist the person to sit down in the seat and protect their head from hitting the door frame. Remember to bend your knees or squat instead of stooping over the person. Ask the person to swing their legs into the car. If they need help, you can assist them by kneeling or squatting close to the person's legs. You can help to lift their legs and guide them into the car. Remember not to reach too far or twist. This will help to protect your back. To get out of the car, do the same thing in reverse. These are the key steps to remember on safely transferring a person into a car for people who can weight bear. Place the wheelchair next to the car. Have the person move to the edge of the wheelchair. Assist the person to stand up. Have the person hold the door frame or the back of the headrest. Do not hold the car door. Help the person to pivot and take small steps back. Assist the person to sit down. Protect their head. Help the person to swing their legs into the car. Remember to kneel or squat. Please remember to follow these steps to ensure the safety of the person you are caring for and yourself. We hope you enjoyed learning about all the moving and handling techniques shown in this video. It is important to practice them with your friends and family so that you feel comfortable and safe when attempting to complete any moving and handling activity with your loved one. Here are some key points to remember from this video. 1. Always protect your back. Remember proper body mechanics. 2. Always assess the situation before beginning any task. Remember the light assessment. And 3. Always involve your loved one. Have them help as much as possible and always tell them what you are about to do. Remembering what we have taught you in this video can help to make both you and your loved one safer. At Circle of Care, it's good to be home.